Then after seeing my parents, I found a change because I left my father seeing, but when I came back, he was blind. He couldn't see. Then my mother, I left her like a young girl. I found her older, but fat, you know. Then all my other siblings had grown up, doing all sorts of things. I went, my sister, this one, Esther, I think you have met her, Mrs. Kapampa. That one, I found her when she had joined S1 in Yakasura. Then I met with my sister. Then after 3 days, because I was supposed to come back to Entebbe to see the matron, I went straight to matron in Entebbe, because those days they are the ones who used to find us. You will find a job waiting for you. There was no this business of haunting the jobs or what. I got they posted me to Guru. I said, no, I'm not going to Guru. But Dokora, I don't go there. She was laughing. She looked at me, started laughing. Said, Mwabatoro mwepanka biki. You go and work. I said, I'm not going there. So I went back home to report her, to report matron who is giving a job to my father. I went, they said, yeah, where have they posted you? I said, they have posted me to Guru. Can you imagine? He said, what's wrong with Guru? Somebody who is not seeing you what he used to sit with his chair, with his inkufira, with his stick. I said, I expected to work to Mulago. I have never worked anywhere. But of all places, Guru, at least they should have brought me here. What are you talking about? You did all these trainings. Is England near? Did you know people? You are supposed to work anywhere in government, in anywhere where they take you. You have no, do you know you have no place here? When I said bye to you going to work, now I'm so pleased you have finished. You have to work anywhere. I don't have any place for you here. You have finished what you want. I said, and he was serious. So I said, this man used to be my friend. Now he doesn't like me because I've gone. He's telling me to go and work where they have given me. I had to go and ring back to Entebbe, telling Kiwanuka whom I came to report. I said my father has refused. He said I should go to Guru where they have posted me. He said, yes, Guru is a nice place. You are just not a girl. There is so many young people from Makerere going there or doing what? You know, go, you will meet a lot of people. I said that one, I don't want to meet a lot of people. Then she said, but you are going to get 2 cars, a staff car and a lorry. I said, I just looked at her. I said, 2 cars? What for? A lorry and a lorry? What for? What am I going to put in a roll? I have no things. She said, okay, don't worry, we all start without things. You will go, you find a furnished house, you will get everything there. Plates, everything. You have your bed sheets. I said, those I have, that's all I have, my personal things. She said, yes, those are the ones you want. You will go, the stores will give you plates before you buy. Everything you can borrow. You are lucky you find, you think Bazungu came with things here. So I went to Guru, did not knowing anybody, not what. But when I went there, I met a man. The first person to meet was a man called Kavuma, a police inspector. When he looked at me, he was driving, I think going to town. He looked, he said, no, this must be somebody, either from where, because he said the color. She said, I have never seen somebody with a color like you. Fire Kataine things, brown. He came, he just parked there. I was so frightened, but when he spoke Luganda, I said, they have some Baganda people here which can speak the language I can hear. So he said, I knew straight away, sorry to frighten you to stop, but when I was coming from different direction, I saw you. That's why I have come to stop. So I started so many people, and have you heard of Mugoya, Mr. Mugoya? He passed on. That's where I met them as a family. So they took me to the hospital. The hospital I saw, not as bad as the hospital are these days, because the Bazungus were still there, most of them. I found from England, you can imagine good.
So can you tell us, what does retirement look like?
It's good if you have something to do and if you have prepared for it. Because at least for me, God loved me. Anyway, I was working in between doing this VAO because apparently in 1987, first woman from to work anywhere else in Africa was me. I went to Sudan by airplane. Again, I thought I was going to Sudan, South Sudan. But the Bazungu convinced me, no, you are going to pass Geneva. Then I was civilized again. Sit on the airplane, went to Geneva, first class. This one was even a first class. From where? In what? As you might know or you don't remember. You people who were born in Yamin's regime, you don't know what you are facing. But me, 87 plane, first class, I traveled. They said, Geneva. You are going to go to Geneva first. I said Geneva, and I had never gone there when I was in England. Then from Geneva, we went to Sudan, Shagarab, North Sudan, where there are Arabs. I went to the board of Ethiopia to help put the Sudanese, I mean the Ethiopian Eritreans, back because they had gone to the board. So I worked in a place called Shagarabu in Sudan, and I had gone for, they said you can stay here as long as you want with us in league. I said, no way. I left my children very young. I think you are the people who your mother is the one with my sister who used to suffer with my children checking because they were young.
So finally, what would you tell somebody who wants, a young lady who wants to go into nursing?
Oh, it's a very noble job. It's spoiled here. Nursing is not for money. But eventually you get it. You get money. If you want, and you have to like it, because it isn't easy. It is not easy, by the way. But for me, I couldn't do anything else apart from nursing. I did it up to the end, nursing, and I'm not up to the end. I'm still doing it, counseling, doing what? But those days, they used to call it advising patients. But I couldn't do. Anyway, what can I do? I'm impatient. I can't be a teacher. But nursing, oh, you do what you want. A patient comes in the hospital dying. If you are lucky and what, you can save. You see a patient, saying thank you. Sometimes those patients hear, and by the way, patients hear, even when they are not talking. Maybe they have no strength to talk. But up to the end, they hear.
Okay. Thank you very much.
Thank you. Thank you for your time.